Patient Forum podcast tonight. Today we're going to be discussing a little bit similar of a subject to last week, but we're going to be talking more about the actual influencers that are causing a little bit of ruckus in the social media communities by just the misinformation, the parasocial relationships, all very similar to last. We have a new guest today, and I'm unfamiliar with this gentleman. I do believe his name is Mike. I would assume that you might be a doctor. Could you tell me a little bit about yourself?
You know what? I don't have a specialty yet, but I just kind of like to wear the clothes.
I noticed you're in a scrub and stethoscope, so that to me that just means that screams doctor.
No way. You really think that?
I mean, I feel like most people would know.
Yeah, I guess. I mean, I'm really just a social worker.
Oh, I
Yeah.
see. I see. Okay. See, that could be a little misleading, because there are people who they see scrubs, they think doctor, nurse, that kind of thing. How do you feel about that?
Well, you know what? I never thought of it that way, but that seems like it could be true. I maybe I should rethink my wardrobe a little bit.
I was just saying it's worth thinking about, right? Like
Hmm.
rather than just kind of make it a joke and be like, how could somebody think that? That's crazy. Everybody has a different mindset, a different intellectual, abilities. Everybody has a different perspective on things. So I think
What
it's
what if I
something to
just
think about.
lost the stethoscope? What do you think now?
I think it see, that's tricky too. I feel like people automatically assume that if you're wearing scrubs, you must be a doctor or a nurse. And I don't know why that is. I don't say that's correct, but I think that some people might look at you and say, "Hey, that's a doctor," especially because you look intelligent, you have glasses, you clean cut, those are all characteristics of a doctor. So, I mean,
Wow.
to me, you very much do look like a physician.
I always wanted to be a doctor, but I know there's people that have a lot more experience than me. I just like to dress the part, you know what I mean?
Do you feel like that could be misleading to people?
You know what? Now that you say it, I think it probably is.
Yeah, because I feel like, obvious it might be obvious to you and it might be obvious to some people, but I feel like some people that maybe more even like more vulnerable people that are, they might not understand fully that it might take them in a direction where, it leads kind of down a misinformation highway a little
Oh man. Well, I wouldn't want to do anything like that. I mean,
bit. Yeah.
that
Are you
would be
giving
like
like medical advice to people?
that would be like if I had a bachelor's or something, and then I decided, hey, I want to pursue a social work degree. And then I said that I knew more than someone who had 10 years or a decade's worth of experience. That would be wrong.
Well, and I have to say, it's funny that you mentioned that because I do notice a lot of people on these social media platforms that they'll put, patient advocate in their bio, or even doctors of nursing, they will put Dr. So and so.
Hmm.
And people, I've had people tell me, I have all kinds of little comments and stuff from people that I could even bring up and show people that they think these people are doctors of medicine, like physicians, like medical doctors. And it's a little misleading. And I feel like once you're approached saying, hey, people might see you this way. Are you going to change that? And then they say no. I feel like that's more intentional.
Well, I would always correct someone if I was mistaken for a doctor. I
See, now
mean,
that's good.
and I would
I
always say, I could do patient advocacy, but I definitely wouldn't want to mislead anybody like that. That would be terrible.
Well, I'm glad you recognize that. I'm glad you recognize that because I feel like some people kind of run with it a little bit. There's actually a woman on a social media platform, she looked maybe like a female physician, just like I said, same type of thing where, you have glasses, you look a certain way, people just say you must be intelligent, you might be a doctor. Wearing scrubs on a podcast, things like that, people interpret it differently. And I think maybe that person sometimes fails to realize being on the inside, like, oh, I'm just wearing scrubs. It's like, well, some people might interpret it different, they might interpret it differently.
Well, I
So
gotta
I feel
tell
like
you, they're really comfortable.
they
So,
are, they are.
yeah.
That's why partially why I went into nursing myself because I do like wearing scrubs for the entirety of my career. So I
Well,
get that.
yeah, yeah, it's so comfortable.
Now that I know that you're a social worker, you are helping people, so I'll give you that. You do work in medical settings. I would just lose the stethoscope. I think that's a little much. I guess you're probably not doing assessments anyway, but I think everybody should be able to wear scrubs as long as we're clearly identifying ourselves. That's fine. Hey, I'm Mike. I'm a social worker. Hey, I'm so and so. I am not a doctor. I have no medical experience because, like I said, there are the people that will go around trying to kind of say, hey, I'm here to help you, but they don't have any medical background, they don't have any experience in the areas they're trying to help people. I had actually come across somebody the other day that somebody entrusted in them say, hey, I have a medical problem. What do you think about this? How can you help me? And that person didn't have an answer, so they thought they would go just ask the community. I feel like that is quite the opposite of what an advocate is, because you shouldn't be sharing this information with a group. If that person wanted that, they probably would have done that themselves. You know what I'm saying? Like, it feels like
Mhm.
that's just an extra middleman at that point. So, I mean, as long as you have the medical experience and you're in a medical setting, I feel like you can get away with wearing scrubs. Absolutely. But we all have to make sure we are clearly identifying ourselves. Usually, when we go introduce ourselves, when we go into patients' rooms, like, how do you introduce yourself?
Oh, well, I don't actually work in the hospital setting,
Oh,
but
you
let
don't?
me ask
Okay.
you a question because are you saying that this person you're talking about, she doesn't, identify herself or correct anybody?
Not like a medical professional would, or somebody that's in like a position of authority like that, or you're up on this platform giving information. I feel like you should say, hey, I'm so and so, this is my either credentials or experience or whatever. Just like when I go introduce myself to a patient, hey, I'm Allison, I'm going to be your nurse, this is the plan. I kind of lay it all out, that way there's no room for miscommunication. So I
Yeah.
feel like some people kind of lie by omission when it comes to social media. I don't know if it's to kind of garner more views, and people are like I said, people are impressionable. People have different perspectives than you and I. To us, it might seem obvious, oh, well, obviously he's not a doctor, but he's in some kind of medical setting or job, right? And you're a social worker.
Well, I think the moral of the story is that you have to do the research on the person that you're dealing with.
That is a good point too. I feel like it
Yeah.
definitely goes both ways. So it is responsible. You are responsible for your perspective on people, absolutely. Especially if you're going to carry that out and go further and ask that person for medical advice or ask that person to be an advocate for you or somebody else. I feel like yes, you should absolutely be doing your research. But how do you feel about disclosing who you are right off the get go? Not just saying like, "Hey, I'm so and so," but like, "Hey, I'm so and so," and if I'm going to give you medical information or some kind of education, I feel like I should be disclosing my credentials.
Yeah, I agree with you, and I think that,
Mhm.
it's very interesting to me that I did research on a person the other day who did exactly what you're talking about, who wore scrubs, and,
Mhm.
it turns out she only had a bachelor's degree, and she was pursuing the same degree that I've had for over a decade.
Yes,
Can you
I
believe
heard
that?
about that. Yes, I heard about that. And see, that's concerning to me because from what that person advertised on their bio, didn't mention their work history. Like, okay, so you have that degree. We know people who have nursing degrees, but they don't work in nursing. They haven't worked
Mhm.
in years. Their license has expired.
Of
So it
course.
just, to me, I feel like if you're in that position where you're going to be giving people information that is, they're going to take it like seriously into their medical plan of care. They're going to try to influence doctors and nurses to abide by these things that they're getting off of the internet. I mean, I feel like you have to disclose some type of education because these people are, like, I see it from the inside as the emergency room nurse. I see the people who come in and they have the TikTok, mentality where they would say, okay, well, I saw this, I heard this, somebody told me this, so this is what I want. It's like, okay, well, ultimately, the doctor is going to be the one to decide. We want the patient to be involved in the plan of care always, always, but we also want them to have the right, set of knowledge. We don't want them getting bad information and leaving with bad information. I had a patient once. This was a long time ago. He was influenced off TikTok specifically to take certain kind of supplement. He was doing this like DIY hyperbaric chamber in his friend's living room. This man was a mess. Okay.
Wow.
Um, I don't know if it was because of the alternative medicine stuff he was doing, or if he was already a mess and he was trying to fix it with the alternative medicine stuff. But his urine was green. Okay, his urine was green. That was the first time I ever saw neon green urine in my life because he was taking some methylene blue and some horse like anti-parasitic medications for like horses.
Mhm.
That was a big thing around COVID time. A lot of people doing the deworming and all that. And it's really dangerous. And I don't think people realize how dangerous it is. Also, because a lot of the times these people don't want to admit they found that on TikTok. They don't want to admit what they did a lot of the time.
Well, it
Some are
sounds
some
like
are proud.
TikTok's a very dangerous place when
Oh,
you're
is it
talking about
dangerous?
your, medical, information, you know?
it is very dangerous because it's the wild, wild west. There's no moderation in regards to these things. TikTok does not remove things that are misinformation. You can go and say, hey, I'm a medical professional and this is bad information. They don't care. They leave it up. They don't do anything. So it's apparent that TikTok is not going to be any type of, they're not going to change anything. They're not going to help make the problem better. You heard as well on, what is it, January 19th, it's supposed to be no more, but people will still exist inside TikTok.
Of course.
But yeah, but I know there's a couple of large creators specifically that are very influential in the mindsets of these patients, chronic pain community, chronic illness community. I actually want to show a video, if you don't mind, about just like the rage bait, I guess you could call it. APRNBeauty, I believe is her name, right? Amazing nurse, amazing educator, super cool, level-headed, don't crash out, that kind of stuff. Well, Naya has crashed out repeatedly on social media time and time again. She came from me personally, which is kind of what started me to look into this stuff and see, hey, what is like going on? Because like nobody should be attacking a nurse over a TikTok, especially one that was made in their home, whatever the case may be. There's ways we can rectify that situation.
Yeah, and isn't she going for a NP license? So shouldn't she be a little bit more of an adult?
That's been ongoing for a long time. So she's been, that brings me all into the asking the community for money, the manipulation. People go attack nurses because you'll see this video here, how they create a sense of she's the savior. She's the one changing the community. I have two videos that are really good on this. So I'm going to show them now. But one is this one that shows just the really unnecessary behavior causing trouble in a system that is very hard to work. It's very difficult to work in already. We don't really need these problems. And then the second video is going to show how what Naya is doing is not helping at all, and the problem is systemic ultimately.
I most certainly hope that you're not sponsoring this doctor in any way, because that means that you are co-signing gaslighting patients, not treating pain, and further stigmatizing people who are in pain and people who may have substance use disorder. Is that what fixing cuts does? Because if that's what you're doing, I don't want any part of y'all. Y'all expensive.
She's mad.
It's very aggressive.
That you sponsored this
is rage bait.
And then Nia's rant, of course, her following is all chronic pain patients, a population who already feels invalidated or wronged by a system. They already are, mad that they can't get their pain meds. So they want somebody to blame. They want to fight. They want to argue. And they all started making videos spiraling. And this crusading and bullying and harassing healthcare workers, and it's a shame when it's one of our own pulling the trigger. This is what the end result is, and this is what patients do and think. Let's take a look.
And Nurse Naya, I love you for everything you do, and thank you for doing it. Because thank you, terminated the relationship with them. Further down in the comments, his TikTok is gone and his Instagram is private. And I would hope that there's a little look-see into his employment. Doctors that don't treat chronic pain patients correctly deserve to lose their license.
I think nobody has that.
You're part of the reason that medicine is changing.
Chronic pain patient, I hate to break it to you, but nothing Nurse Nia does on her timeline is going to influence good change in healthcare and going to help your chronic pain situation. If anything, it's going to affect it more because healthcare workers are fed up and tired and are quitting and leaving the bedside. So that means longer time.
And
there are all types with big pharma and the opiate crisis. There are all types of rules and regulations with what doctors can order, but whatever. That's not my thing. I'm not getting into that. But this is what Nurse Nia spirals. Now, don't get me wrong. She's on her side of TikTok and I'm on mine. That's it. We have an understanding. We got each other blocked, whatever. But this crusade and ruining everything that people have worked for behind one thing that you spin. He didn't say anything about not treating patients or substance abuse. You put that spin on it yourself because you knew it was going to make for good content. You don't care about these patients. Like, you have to stop ruining people's lives for clout. Like, seriously.
I don't think I've heard it said better than that ever. If y'all don't follow her already, make sure you do. I will put every creator's ads down below, sources, all that stuff. Either way, she hit it on the head. why are we causing these issues over a TikTok that never happened. That man never said he doesn't treat pain patients. He never said any of those things that she said. And because of the false outrage that they created, that man had an array of issues. Okay. That might have got to the ethics board because that's what they did. Professional background. They don't understand what it takes to get to that level. And they're taking people out of positions that they have to rely on.
Yeah. It's just incredible to me. I mean, I think she said it best. I mean, I don't really have anything else to put in there for that one, you know?
Yeah. So, I mean, ultimately, that's my concern about people like Claudia and Naya and, you know, the people that work with them, maybe Bev Sheckman, who we were kind of referring to in regards to the not clarifying that you're a doctor or not. Why did you think that? Why did you think that? Because all of your community had told me that. So I was respecting them and referring to you as such. Why would I think that somebody would be seen as such if they were not? You know, like, how manipulative does one have to be to even get to that point where a group of people believes that and nobody's ever said anything? But yeah, they're manipulating an entire community of vulnerable people, asking for the donations. Nurse Nice consistently asking for money for her nurse practitioner program. It's been going on for years. She claims she couldn't finish it without the money.
What are loans for? Why can't she pay for it herself?
You know,
why is
get
she
loans,
on
I don't think,
TikTok
because
asking for money?
we found some things looking into her. Either way, that's not here nor there. Essentially, they are utilizing these communities as a bank account, as a way to get money. She's in the creator fund. She can earn her money through views, but no, she has all her links: PayPal, Cash App, Venmo, and then that GoFundMe. That's atrocious. It looks like a child wrote it. It doesn't even it's not even proper English. You're a bachelor's level provider as
And
about to
there's
be a
AI
practitioner.
available for rewriting things. I
It's like
mean,
you're not even using the tools you have available. I mean, I wouldn't trust that person to take care of me. But I want to bring up another video because this all started with me 3 months ago when Nurse Naya took a video that I made on my own time at home and tried to say I wasn't medicating pain patients or I was holding people down or doing something against their will. I really don't even know what the straightforward message was because everybody that came to my page had a different interpretation of said thing. So it's hard to really say what the issue was.
Naya doesn't hold people accountable. Naya takes other people's content and then spins up stories about them so that she can let her audience dogpile them. I mean, really, as a nurse, do you really think somebody's behavior changed once Naya spun up a story about them and had her audience dogpile them? I'll tell you what I think could help with this issue, because it is an issue. There are nurses that behave poorly. I think what could help with it is creating a situation, an environment where that isn't tolerated, where there isn't a shortage of nurses that are willing to work in these corporate spaces that are more concerned about profit over patient care. If tons of people were all vying for the same nursing job, then you could start weeding people out. Then you could start holding people accountable for things that Naya wants to hold people accountable for. But as it stands, nobody wants to be a nurse anymore.
Yeah.
And I feel like nobody's putting like enough influence on that. People like that one woman, let me see if I can pull that video up too. She basically was saying we're under the impression that they think there's an abundance of nurses that are going to take over these jobs when they call and get people fired. So also it's very costly to onboard a nurse and then just get rid of them because of a bunch of people on TikTok. So let me find that video. Yeah, that really explains how she's trying to hold people accountable. These people are not qualified to do so. Nurse Naya suggested I have my nursing license removed for the TikTok that I made. In no world would any board of nursing action be appropriate for that type of thing. You know, it's not on my job time. It's not in regards to a patient. It's a made up scenario. There are tons and tons of nurse creators. Why are we picking and choosing, or medical providers in general that are creators? Why are we picking and choosing who gets fired and we just ignore them, you know, because they're larger creators maybe and they don't want to go after them because they know they're going to get a lot of pushback. Maybe that's one of the issues. They choose the smaller accounts. I mean, it doesn't seem like they go after Nurse John or any of the bigger people, you know, like that.
And they definitely there's bigger creators that call them out too, so might have to reach out to some of them.
Well, that's my goal, is to get some people on here to talk about this, like what's been their experience with these type of people. Let me see. And then for those of you who don't know too, Dr. Yoon even got
do that, yeah.
an ethics thing on him. Yeah, and the man ended up calling and apologizing and retracting it because he was in a heightened emotional state. He had just broken up with his girlfriend or something. It's like, this is what we're making reports on people's hard-earned career. They don't understand what it took to get to that level, and it's easy for them to just pick up the phone and say, I don't like this person, do an investigation. That's not appropriate. Like, there's a course of action for everything. There's a chain of command. There are things that we do to rectify issues, and firing people is not it.
That woman's face just says it all, doesn't it?
It just turns out, though, that most of these people that we've looked into are all criminals. They're wanted. They're on probation. They are, losing their nursing license for diversion. Like, theyese are people that have, like, issues. They're angry.
We could just leave it like that.
And dear God, you lost your. Oh my God, I can't imagine why. Although I was going to be one of those people that reported you to the nursing board, I didn't get out of the hospital in time to get my faculties together well enough to actually make that phone call. So it wasn't me that did it. I wish I could brag. I wish it was, but it wasn't me. However, I am going to try to keep your ass out of more trouble. Okay, so let me explain something to you. Okay, you say hospitals are bold because they dismiss nurses without a sit-down or conversation or even a reason. Do you realize that you live in California? Employers can terminate employment at any time for any reason without needing to provide anything specific on why.
So they call the job and say something crazy.
So they know how to research, but they don't know how to research the right
They don't have to have a reason
information.
to fire you. They don't have to be courteous. They don't have to have a reason. They just don't like your face. They can terminate you, period. So I tried to tell you, even though you're standing in your kitchen and you're on your break and you're in your car and you're still representing the company that you work for. And that's why you're now unemployed, sweetheart. Because you misrepresented them. They didn't like the way you represented them outside of work. Hence the termination. Okay, let me address a couple of other things.
What's the proof?
That,
I asked several times.
You were kind of shocked that the hospital would let perfectly good, competent nurses go. You have to realize you have a very inflated sense of self. Okay, a hospital is not going to spend money on its lawyers to defend a nurse.
Why should they have
There's
to? Is my
question.
question.
Who has a big mouth, don't know how to shut a pie hole.
A nurse.
They're not going to spend the money to defend you in any sense of the word. They're going to let you go, and that's exactly what they did, and that's what they should have done. Because I told you weeks ago, shut up, and you didn't do it.
And I'd like to know
exactly what the hospital.
I just want to interject by saying this woman came to my page on several different accounts. Apparently, I thought she had cancer or something. She has something called stiff person syndrome, according to her page. Her name is stiff person something.
Stiff person stuff.
So I guess she has her own medical trauma issues in with healthcare providers. There's several videos like this of her saying she was documenting everything every time people came into the room. Like, her trust in the healthcare system is zero. So of course she sees a nurse on a thing she's on all day doing something that I guess she didn't like. It had to be reported to the board of nursing. So unfortunately, the board of nursing does highlight that they don't take complaints based on personality conflicts. So that's exactly what this is. You don't agree with something that somebody posted, that doesn't make it unethical. So I think that's something we really need to talk about too.
Yeah, nobody's coming to your fence. Honey, you are replaceable. Always. In this job, in your next job, in your next job. You're replaceable. Period. Everyone is. You're no exception to the rule.
Nurses are not.
You're gone. You act a fool.
Maybe
you're gone.
she's dispensable. What does she do for a living? Nothing?
This seems no, yeah, sure. I mean, she's not very nice. I mean, I understand having a disease process can make you have different emotional issues, but I mean, that's not something that you should take out on a stranger. Nonetheless, one that provides excellent care. I've been a phenomenal nurse for entire 15 years in the field. Proud of what I do because I know I'm a top quality nurse. I know I take my job seriously. I take care of my patients like they were, my family member. I really just resent when people that don't know a nurse wants to bash them on a social media platform, make pages with their face saying all kinds of things. That is very inappropriate because you don't like a TikTok that somebody made. There are ways to have these conversations. That's a conversation that you can have constructively. Hey, what can we as nurses do better so you feel more comfortable with us posting? Because nurses are going to have social media, and I know their thing is like nurses shouldn't. They shouldn't be able to unless they're going to post about, something totally unrelated to their job. Well, we're very proud of our job. We see a lot of really crazy and cool things and things we want to share for educational purposes. And it's really unfortunate that that's kind of been just kind of stomped on.
To my knowledge, unless you're sharing patient charts, making friends with patients, or doing any of that on social media, you're fully within your contract for social media.
And somebody else mentioned as well, basically, you can't film in the bathroom, you can't film in the parking lot, you can't film on your break. Well, their social media policy needs to outline you can't film anywhere on their property then, because it doesn't say that. It doesn't say that. It says you cannot film in patient care areas. I mean, that's across the board. I've worked in many, many hospitals. I always look at the social media policy. It doesn't say that you can't film yourself in the bathroom mirror if you don't want to. They need to put that in their policy if that's something that they want people to honor. And with the new age of nurses coming in, social media is going to very much be a part of their lives. They're going to want to share their experience and their journey, and they're not going to accept that. Unfortunately, they're just going to say, I'll go work somewhere else, because there's going to be places that not only accept social media, but they encourage the use of it for education and sharing things that should be shared.
The proof on TikTok where someone accused someone of something and didn't have the proof up on the screen to prove it.
Here she's saying it's defamation to say things about people like they're criminals, they're felons, they're wanted. Well, there's proof of all of that. 4 characters specifically that have done a lot of these mass callings, harassment. They continue to harass people on a daily basis. Like I said, TikTok will do nothing. Somehow this woman found herself wrapped up in that. Seems to think it's defamation to say these things about those people. So she actually sent a message to somebody, a mutual of her and myself, saying like, who are these people? Because I guess she was kind of wondering like who I was talking about. Like, lady, you just wandered in here. Like, these are criminals, whether you want to know it or not. So essentially she said, I'm here to just bully the, out of Allison and blah, blah. So I'm going to make a separate episode about this woman in particular and just her strange behavior.
Say one more thing regarding people like this, and it's they never consider the family.
Well, I was gonna say, I'm a single mom. Like, why would
you're a single mom, and what about it? What about this is funny? Exactly.
That's the part that's concerning.
Like, let's say that you were to lose your job, which obviously has not been confirmed.
She's enjoying it thoroughly.
She's enjoying it, and she's enjoying the fact that your daughter might not get a Christmas present. That to me is
and that's the thing.
Disgusting behavior.
This would be a terrible time of year for a single mother to lose her job. Why would this be the reaction to that? A nurse, nonetheless, somebody that helps the community. Like, that one nurse is going to cause those waiting room times to go up quite a bit, because she can take care of at least 4 patients at a time, at least 4. So now y'all going to have to sit and wait a little bit longer because they're down a nurse now. So and they got to go hire a whole new one. And
they're down an advocate who's going to go to the doctor and ask for the pain meds that they want. Aren't they?
I mean, in my case, like, I am a very strong advocate for my patients, like my methadone patients. If I know you're on methadone, I'm going to work on that before I even come introduce myself, because when I walk in that room, I want to say, hey, your methadone's on the way. And it's not easy to get methadone in the ER. We have to call clinics. We have to do a lot of chasing around pharmacy, say, hey, can you make a dose for them? Well, didn't they take it today? No, they didn't. They've been here all day. It's a lot of advocating, and it's something that some nurses are just not willing to do. So the ones that are willing to fight like that, you can't be getting rid of them. That's crazy.
Yeah, it's just really very sad, in my opinion.
Ultimately, I think that reaction is very sad. So let me just play the last little bit, and then I'll move on to the next.
Okay, and then you can get her off the screen, please.
So I would shut the fuck up if I were you about talking about
defamation. That's true.
Unless you have proof up on the screen, you're going to get yourself in another boatload of trouble. Also, you mentioned that no one wants to be covered in pee and blood and vomit and all of it. Girlfriend, you chose that profession. You knew that was part of it. That's just the job. That's like choosing to be a mechanic and then not wanting to get greasy.
No, it's not.
That's just part of the job. You chose that
No,
job.
it's really
all the way to nursing school, all the way to your first job.
What
you chose that shit.
Comparison.
That's on you. That's
who did that to take care of people like you that need to utilize the medical system frequently. So it just boggles my mind that would be one's reaction. And also back to like the demeanor and all that kind of stuff. If something needs to be reported, that's a serious matter, right? Like do your report and move on, right? I don't know. I don't understand all the theatrics and the drama behind it. The amount of people that have called the Board of Nursing on myself, other nurse content creators, just really anybody that I guess they say, oh, that person rubs me the wrong way, I don't like them. That's a personal conflict. A personality conflict. You can't report that to the Board of Nursing. And if you continue to do that, they will say, hey, you are doing this over and over and over again. There was 4 people involved in my situation that I had to tell an attorney to contact the Board of Nursing and say, hey, these people are reporting every nurse they can come in contact with on TikTok. Just because they don't want them existing. Yep. There's one particular video where the woman is saying she lost her TikTok account briefly. Mm-hmm. And basically it was because she said, oh, we get attacked when we tell professional or tell nurses they're being unprofessional. ma'am, you're a felon, a wanted felon. We found this out, okay? Confirmed. So these people are
Not
all
to
getting their
mention, they don't
own episodes.
understand that there are other people in the world that may not like their content.
Yeah, it doesn't compute. It's like, if, it's not what we agree with, it's not, cool with us, it's got to be immediate termination. That is not an appropriate intervention for a TikTok that you didn't like. Okay? If there's a patient that's being abused, harmed, you're directly seeing something wrong, even then, I don't think it's TikTok's job to be calling in mass. One person can call and say, hey, I saw this, I'm concerned. One person can do that. So, I mean, I don't understand like the false outrage. They're like, oh my God, let's all call at once. Let's all call every day. Again, I have, comments from these people. We will call your job every day until they're sick of you, basically, and sick of this, and they won't deal with you anymore. That's their plan. They do that to person time and time again. And they know that it works because they say, well, we're a chronic pain patient. Most of these people have found not to be, because true chronic pain patients and chronic illness patients want their nurses, and they want them to be better, and they want them to improve. They don't want to lose more nurses. That's longer wait times, longer time to get your pain medicine. I mean,
And you know how I know this is true? Because I'm a chronic pain patient.
Yeah, and you would never do that.
No,
I know that.
never.
And that's why so many people in this community, I think, have like backed out, and it's not truly the chronic pain community. It's like a rogue offshoot of them, because the true chronic pain and chronic illness people, they don't want that. They don't think that's appropriate. I'll tell you right now, unless it's somebody that has a serious vendetta against nurses, which it's not usually that group. It seems to be this group that they don't have things in their life to be proud of. They don't have, for example, the one person, she wasn't even in pain management.
Yeah.
She was lying about that. And then she was taking money from people in the community. There's a nurse involved that she was diverting medication. That's been confirmed. Now we're just trying to figure out where that medication was going, because it was a lot. And it seems like TikTok is a crime hub. It is a crime epicenter. It is.
I personally gave money to the same woman you're talking about. So.
Yep. So for a fact that is the case. There are pedophiles on there. There are people who are buying and selling drugs on there. There are people that are manipulating vulnerable communities for money. Just like you said, you sent this person money. You are not the only person that sent that person money. So I think it's like, we've just uncovered one small section, and it's a rabbit hole. Every day there's something new. Every day there's an arrest, a warrant, a sheriff phone call, something, right?
Yeah, I agree. It's too much.
It's too much. It's too much. And it's like, it shouldn't be that way when you're on a social media. Why is it leaking into real life and legal avenues? You know what I'm saying?
That's the problem. I mean, luckily the legal avenues would be on our side, but it's just a matter of what you can report and what you can't,
Yeah. And I feel like bringing your emotions into this stuff is really inappropriate.
Yeah.
I feel like bringing your emotions into TikTok in general is a problem, and that's where the parasocial relationships come into play. So nobody wants to talk about it.
No. And as I said in episode 1, we just got so stuck in the house during COVID
and I think that's where a lot of it started. Yeah.
Yeah, it all started then.
All right, so let's
this comment. This is the Suboxone scam. That's all this is. Nobody's going to tell me any different. The war on OxyContin was always about knocking out OxyContin, replacing it with an inferior drug that failed miserably in the 70s for the treatment of pain. But today, we know that it's linked to dental decay. And now we're learning that Suboxone is linked to suicide. And this whole overprescribing of Suboxone movement.
I just want to interject there real quick, because I feel like she does a lot of fear mongering. We know a lot of these medications come with black box warnings, side effects like tooth decay or blurry vision. These are things that, unfortunately, a lot of people have to weigh that risk and benefit. So it's not fair for her to say, if you take this, like almost like you're there's something wrong with you, or it's a bad choice. They
also explain all of this to you before you take it. So
yeah, so it's a personal choice. So I don't know why she's acting like it's something that's a secret.
One day we're going to look back at this time and question, why did we listen to the doctors of prop? Because they really are responsible for a 900% increase in deadly overdoses. And now they want pharmacists to prescribe Suboxone, because, hey, why not? You can never have enough Suboxone. The overprescribing of Suboxone.
Suboxone is much needed. There are a lot of people that has saved their lives, that has given them their structure back. They don't feel the need to use their initial need to use,
It
maybe
saved my life.
is related to pain or something like that, it is gone, so they don't have to worry about getting high to reduce their pain levels. So
Mhm.
Suboxone is really a miracle medication. MAT in general is really a miracle for a lot of people. So I don't think it's fair for her to kind of like cause that, hysteria over something that
And
people
what's her
have.
background? What is
Well,
her
that's the thing. And
education
and
in?
these people, regardless of her, like these people have their right to choose what they want to be on. Her medical background is non-existent. So I don't think it's fair for her to make these decisions for people or create this, false outrage for people to be afraid to take the steps that they need because she doesn't have the experience.
Yeah, because I think I did my
Yeah,
research on
nothing.
her and I found out she was a retired court reporter, is that right?
So that's, yes, she's court reporting is her background. So I
Okay.
feel like that is totally irrelevant from this area. If you want to share your personal experience and be a support person, I think that's great. That's fine. She was offering one-to-one advocacy. Her behavior was very, very strange and impulsive. There was a woman in Missouri that had to get a restraining order against her, and she has sent people out to rallies. I believe you could tell a story about that.
Yes,
Disabled people.
I actually did a rally for her when it was called Don't Punish Pain. It was before the whole DPF organization, and I found it on Facebook. It was called Don't Punish Pain New York, and she reached out to me directly and said, "Would you mind hosting a rally in your local area?" And I said, "Sure, I'd love to." But, even back then, I was in my early 30s. I didn't know how badly disabled people are, but I found out that day that
Yeah.
nobody could make it, you
So,
know.
and then like after that situation, and like, did she say like, I'm sorry that nobody came to support, or like,
Never
did
heard
she
from
like
her
offer
again.
any?
Never heard from her again. She never answered me ever again.
And you reached out and she said nothing?
Yeah, I reached out. She said absolutely nothing.
Oh my God. Well, I had a similar situation with Naya when she put that video of me on her page and said, "Hey, can I like talk to you about this? Like, what are you doing?" She said she told somebody else, I don't want to talk to her or something. She couldn't even bother to respond. Like, these are women, you know what I'm saying? That's not womanly at all.
No.
That's pretty
Is
immature if you ask
nothing
me.
but a con.
Like, to tell somebody their life-saving medication is a con, should we say opiates are a con? No, we
Right.
don't say that. Like, that's inappropriate. Like,
But
why
I
would we say
encourage
that?
everyone to watch the documentary called Painkiller. It's on Netflix right now.
That's a
And
good
see what
one.
you
Yeah,
guys
that
think of
ties into
that
this.
and make your own decision.
Lots of
Yeah.
addicts, and all of them started with pills. It's not uncommon for drug addicts to surround themselves with other drug addicts.
Okay, so
Really?
she just called that person a drug addict, about
We
their
call it
history.
SUD now. I thought we don't
Now,
use that word.
isn't that funny how it changes when we want to call somebody something,
Yeah.
because it makes us feel better, I guess? Okay.
And I
Mhm.
think that's the situation that you found yourself in. What I've learned as a patient
That's
advocate is
bold.
most addicts come from a
Patient.
long line of drug addicts. And they're stuck in this vicious cycle, but they all have one thing in common. They all started to abuse alcohol.
I'd like to know exactly what
What?
she did.
Okay, history of addiction, never abused alcohol. Wasn't my
Yeah,
thing. I don't
same
know what
thing.
she's
I have
talking
not
about. That is
drank
such a strange.
since 2011. Not one
Why would
drink.
she put that information on a public platform as fact?
Right.
And then
And
they
uh,
probably found
and
their way to weed, but that wasn't doing it for them. And then they found their way to other street drugs. And the government interrupted that safe supply of drugs for drug addicts.
Wait. So they were using drugs they weren't supposed to be using, and the government interrupted the safe supply? They weren't prescribed anything. What does that mean?
yeah.
Interrupted their safe supply. They were getting drugs elsewhere. Apparently, they were using marijuana and alcohol, right? What are we talking about?
Yeah,
Which is
what
why
are
we
we
have
talking
100,000 Americans. But lots of addicts, and I'm 56. Now, I was prescribed opioids on and off for years. I never graduated to street drugs, nor did my mom, my dad, my siblings, any of my friends, or any of my family members.
Okay, now somebody, a personal, I guess, acquaintance of this woman said, I guess it had to do with her book, that her dad used to give her Dilaudid. So, I mean, that's just drug dealing and drug use within your own family. That's just because you didn't go to the streets, you're
Right.
still.
And if you take it from a family member, what's the difference?
That's what I'm saying. That's the same thing as you going out and buying it, except you're not paying money. You're still obtaining it in a way that's not prescribed to you.
Correct.
The data supports this.
And I do have a somebody that said that in their own personal words. So if anybody wants to see it, I will bring it up.
99% of the population will not become a drug addict because of a doctor.
Wait, back that up.
The data supports this. 99% of the population will not become a
99.
drug addict because of a doctor's script.
99% provided sources for that.
99%? I mean, that's a really high number.
That's crazy.
I just feel like it's to put that kind of information out there as like a person with 300,000 plus followers. Clearly, there are people that think you are educated and you know these things and you're very matter of fact about them. And to them, it offers maybe like some kind of validation or hope in their situation. And it's like, I just think it's highly inappropriate to speak on things like in that manner. You know what I'm saying? Like
Yeah, I mean,
villainizing
if the
somebody's
video
treatment
was
plan.
about,
Like
but
these are very personal choices. So I feel like to kind of try to influence people in that way is that's not what a true advocate would do, in my opinion.
no, I agree. And if
Let
we
me
were
see what.
talking about court reporting, then I would feel better about this whole thing.
But I just don't know even how, like, she didn't even go take any kind of classes or anything like that. Like, you should at least get some type of certification, no? If you're going to be offering one-to-one services, which obviously she had to stop doing because that was inappropriate.
Or you can get a
Yeah.
KSAC in less than a year.
So why didn't she do that? She should
Exactly.
have done that. So that would have
Exactly.
been an option. So it
Mhm.
just, to me, it shows people, they don't want to put the effort in. They don't want to go to the school and get the education. They just want to be. They just want to be it. And it's like, I think that's dangerous. I know it's dangerous because I'm the one taking care of the people in the emergency rooms. Like I said, I've worked in several, East Coast, West Coast. I see it firsthand, people coming in with their TikTok knowledge, and it's harming them because one, a lot of people won't even put up with that. They won't take it seriously. Okay. Me,
Mhm.
I love social media and I love that people, explore and they do those kind of things. But at the same time, we got to like have a line in the sand, something that says this is bad information or it's good information. TikTok is not a good moderator of it. So I feel like we should have medical professionals on the platform moderating this stuff, just like they found the Alana. Remember, they found Alana Harris's baby was not the story that she was posting online versus the actual story that was happening that these nurses were documenting. There were massive discrepancies. They were the ones who pointed out. Meanwhile, this woman had tons and tons of people following, cheering her on, proud of her, and all this stuff. And it's just like, it's
Proud for
devastating.
what?
She basically was advocating for her child, and everybody was cheering her on. Advocating, aka taking her child to doctors over and over until they did what she wanted.
She
So,
was
I mean,
poisoning her child, basically.
drugging her. Baby had brain surgery. Her whole head was stapled across. Like, just nightmare stuff, all for the benefit of the mother. And I understand mental illness is a factor in these situations, but people are just being mentally ill out here on TikTok.
And they
Nobody's
used
doing
to call
anything about
that
it.
Munchausen's by
Well,
proxy, but
now
you
it's
said
fictitious
they're
or
changing
fictitious.
to something new, right?
That's in the DSM-5, but either way, I think that more changes need to be made in regards to diagnoses via social media. Like these
I
people
agree.
creating these massive platforms and essentially controlling people and telling them their narratives and what they want to run with. So what? So you can get access to your pain medications? I
Well,
don't
that's
understand the end
literally
goal.
narcissism, so it's already in there,
It's like, well,
you
and then
know?
we discussed that last week as well. And I feel like a lot of it is attention seeking as well. And just having to have that control. And it's very dangerous to the people involved. And they don't realize because they're being love bombed or they're being told and fed these things, these promises.
Mhm.
And it's empty. It's empty and it's dangerous. And I mean, we have to have more awareness of mental health issues via social media. Just like Nurse Naya, why are you crashing out like that about a figs commercial? Like, enough. It's problematic and it's causing real life problems. It's not just social media. They're taking it real life by
Mhm.
contacting medical boards and employers, and we don't have the staff for them to do that.
Yeah. But are we going to talk about Alpha Dom next week?
I think he should have his own episode. I almost feel bad for him.
And he's also threatened other women with PIs.
Yeah,
So
he had 44 businesses. Why would you say that? Like, obviously you can look that
44
up.
businesses
He
of
said
what?
he said I'm untouchable. I have 44 businesses and he's a multimillionaire or something.
Yeah, guess what? You're not untouchable by a restraining order.
Yeah, that's the kind of behavior we really have to highlight. That's why every week we have content. We
You
have
have
literally this
endless
weird.
content.
Oh my
Endless.
god! Oh my god! Oh my god!
Endless.
And I will never shut up until there's some kind of law or something in place that will help, get rid of these people that are just influencing on a mass scale when they are not equipped mentally to do so.
Yeah, and I'll be with you every step of the way. Don't worry.
Yeah. Well, I think the podcast is a great step in the right direction. We're bringing awareness. So everybody that's tuning in, thank you so much for being here. We will be here with many, many more episodes. We're wrapping this one up now. It's going to be every Wednesday so far for now. It's working out. It's 8 time, 5 Pacific Standard Time. So we are making it work. If
We're
you guys
actually
have
doing this across the country from each other.
I think that's pretty cool. And me and Mike used to live the next town over from each other, like pretty much.
But we were pretty close. Yep.
I mean, yeah, pretty close, like literally the county next to each other. So I just
Yep.
think it's kind of funny how things come full circle. But Mike has a lot of great expertise to add to this. He has a great perspective because he's been affected by these people with these strange parasocial relationships. He's, tried to help these people only for it to backfire. So we will be here with many more stories.
I want to be very transparent with everybody that my New York State license is inactive because I am disabled and I
but he's a
don't
social
pay
worker.
for it to be renewed, but that doesn't negate my education. That's all I want to say.
Exactly. So he's still very much qualified and has the experience, which is literally all that you need. You can be a patient advocate. You can be all those things. You don't need a license. You just need some type of actual real world experience. So that's all we're trying to drive home. Actual real world experience. So that's all we're trying to drive
make
home.
money doing it. That's all.
Well, we'll figure out ways to monetize helping, bring awareness to the situation, because this is important stuff. And even if it's not related to like medical care and people getting bad medical advice, there's parasocial relationships in all aspects of social media that are highly dangerous.
Oh, so, God, yes.
Yeah. I mean, literally wanted criminals. Okay. Nothing shocks me anymore. So there will be plenty of story times to come on that.
Well, thank you everyone for joining us.
Thanks,
Alice
everyone.
and I are happy to have had you tonight for an audience, and we can't wait to see you next week.
Yeah, I'm going to edit this and we'll get it up. And then you guys make sure you comment below any creators that you want us to cover, any topics that you think are important, and we will go ahead and make those episodes for you.